The Heimlich maneuver is very important because it can save someone from choking. There are 4 variations of the Heimlich maneuver. One is for someone who is not an infant or pregnant. The second is for someone who is pregnant. The third is for an infant or toddler. The fourth is for yourself. The Heimlich maneuver is used when someone who is having difficulty breathing is doing one or more of the following: signaling for help, typically with their hands around their throat, not coughing or hacking to try and get the object out, having difficulty speaking or not speaking or breathing at all. If someone is choking, you may offer them assistance if they are unconscious or they aren't coughing. If they are coughing, then you should assess the situation, though they may be able to get the object out without your help. Heimlich maneuver for someone who is not an infant or pregnant. Call 911 if you can, or tell someone else to call 911. If you are alone, however, 911 is not your first priority. Your first priority is to get the object out of the person's throat. Stand the person up if you can, then move behind them. The person will now be leaning forward. Place your arms around their waist and make a fist with the pinky of your hand slightly above their belly button. Grab your fist with the other hand. Perform thrusts using an upward and inward motion. Keep doing this until the object falls out of the person's mouth and they can breathe by themselves again. If they can't stand for whatever reason, lie them down on their back and straddle their waist. Face their head and place your hands in a fist exactly the way you would have if they had been standing. Give thrusts until the object comes out of their throat. Heimlich maneuver for infants. Some signs that a baby is choking or can't breathe are weak coughing or no coughing or ability to make sound, unconsciousness, blue skin, weird breathing. For example, softer or higher pitched breathing than normal. When a baby is choking, the first thing to do is lay them across your forearm, with your forearm resting on your thigh, as shown in the picture. Support their head and neck with your hand, pointing it downwards, as you use the other hand to thump them forcefully on the back. Do this a few times, making sure you don't hurt the infant, though the blows should be effective in knocking the object out. Do these blows 5 times. If that doesn't work, lay the infant on their back on your thigh or lap, supporting their head with your hand. Place 2 fingers on their sternum, the bone located in the middle of their chest between the nipples, and push the chest down about 2 to 4 inches. Give 5 chest thrusts quickly, then give them 5 back blows and keep doing this either until the object comes out or they lose consciousness. If they lose consciousness, give them CPR for infants and call 911. Heimlich maneuver for pregnant women. To do the Heimlich maneuver for pregnant women, you can't use the regular method used on non-pregnant people. To the Heimlich on a pregnant woman, make a fist as you would with a regular Heimlich maneuver, but instead of placing it near the belly button, place it near over their lower sternum, the breastbone in the center of the chest. Push in while squeezing the entire chest. This looks almost like the regular Heimlich maneuver, but is more similar to chest compressions because you're going to be pushing straight in and out, about 2 inches. Keep doing this until the object comes out of the person's throat. Note, in some cases, this can also be used on individuals who are obese. If a regular Heimlich isn't working on the person, you can try this instead. Heimlich maneuver on yourself. One way to perform the Heimlich on yourself is to make a fist with each one of your hands, then place it slightly above your belly button. Using the other hand, grab your fist and give yourselves thrusts, pushing in and upwards. If that doesn't work, you can also lean over a chair or table, pushing the area above your belly button, or the upper abdomen, against the surface in quick, hard motions. Keep doing this until the object comes out.